Good afternoon. Thank you for joining the World Affairs Council Upstate as we learn about the future of food safety. This is a distinguished speaker event with Mark Moorman, Director of the Office of Food Safety for the Food and Drug Administration. The World Affairs Council Upstate is part of a nationwide system of organizations dedicated to engaging their communities in foreign policy, international business, and global impact issues. We're non-political, nonpartisan, and we strive to bring information to you in the most academic and unbiased manner we can to allow you to form your own opinions and ask your own questions. As a 501c3 nonprofit, we depend on your membership, your donations, and your engagement to fulfill our mission to bring the world to South Carolina. If you're not a member, please consider joining us today, or ask your business or maybe your educational institution to partner with us. You can find more information online at World Affairs Council Upstate. Today, I'd like to give out a special thank you to Colonel David E. Davenport, U.S. Army retired, for helping us support this distinguished speaker event. As we go into our speaker today, I'd like to ask you, have you thought about the global marketplace and where our food comes from, whether it's safe? I'm sure recently, given all of the recalls across the last year, the potential food shortages and difficulty in getting products, that we've all been thinking about it. The pandemic has accelerated the need for traceability of our food and methods that will help us predict disruptions in food supply. So I am happy to bring to you this event now by starting with introducing our moderator and kind of our conversation starter, Mr. Rob Rowan. Rob is the president of Global Action Coalition, an NGO working in Nepal and Djibouti. His involvement with the military and service to the international officers at CENTCOM led to his being made an honorary ambassador to the coalition forces at CENTCOM. He is a South Carolina delegate to the U.S. Global Leadership Coalition and currently chair of the World Affairs Council Upstate. He's actively involved also in the St. Petersburg Conference on World Affairs that occurs every February. His new project is the think tank to address international cooperation between the military, diplomats, NGOs, and countries in crisis. Last of all, he's finishing his first book, Defining Moments, about amazing people he's met through all of his different work and the lives that are an inspiration to us. So with that, I'm going to turn it over to Rob. Rob, thank you for joining us today.
Welcome, everybody. I think you're going to find this more interesting than you expect, because I think Mark has some interesting facts and figures and information for us. Let me tell you a little bit about Mark. He's the director of the Office of Food Safety at the Food and Drug Administration, where he leads a team of professionals focused on improving the safety of our food supply. Prior to joining the FDA, he was the Senior Director of Global Scientific and Regulatory Affairs for the Kellogg Company in Battle Creek, Michigan, with responsibilities for emerging food safety and nutritional, technical, and regulatory issues. He was especially involved with making sure our frosted flakes were perfectly safe for us to eat. Prior to joining the Kellogg Company in 1998, he spent 10 years with Silliker Laboratories as a Technical Director of Microbiology. Mark has an undergraduate and Ph.D. degrees from Michigan State in Microbiology and Food Science. And before I hand this over to Mark, just to give you an added to what Tracy said, why this is so important. These are some interesting facts. An estimated 600 million, that's 1 in 10 people in the world, fall ill after eating contaminated food, and 420,000 die every year. The U.S. spends 110 billion and is lost in each year in productivity and medical expenses resulting from unsafe food in low and middle income countries. Children under 5 years of age carry 40% of the foodborne disease burden, with 125,000 of those deaths. And unsafe food containing harmful bacteria, viruses, parasites, or chemical substances cause more than 200 diseases, ranging from diarrhea to cancers. So that gives you a sense of how important this issue is. And I'm really excited to hear what Mark has to say and what he and his comrades are doing to make this country safer. Mark, thank you for coming.
Hey, Rob, thank you very much. Kim, Tracy, it's really a privilege to be here. Thrilled to talk with you, with this group about something that, frankly, I'm at a point in my career where I am just consider myself very fortunate to be leading an office that's heavily focused on preventing foodborne illness, and coming in at a time, I've been here a year and a half, 30 years in the private sector, as Rob said, where the agency is rolling out a completely different way of thinking about how we go about food safety. First, about our office, I do lead the Office of Food Safety. It's the largest office within the division called CFSAN, Center for Food Safety and Applied Nutrition. I think the simple way to look at the FDA is there's the drug side that we hear so much about with vaccines, and then there's the food side. And I lead the largest office within CFSAN. There's about 200 of us that spend our time figuring out how do we prevent foodborne illness. We have pretty much experts across every aisle of the grocery store. And I learn something every day working with these individuals. We also have 2 laboratories down at Moffett facility in Illinois, and then a seafood facility, Dauphin Island. When they're not busy doing research on seafood, they're dodging hurricanes. If you looked at what our office does, we do policy. We put out regulations and guidance documents to say, here's the agency's position, the regulations that are the enforcement side of the House of the FDA enforces. We have subject matter experts that work with our Office of Compliance. When we do inspections and we see things that we don't observe, we have experts. We have experts that will support our compliance group to go after those firms, to put out warning letters or even seizure if we need to. As I mentioned, we have 2 laboratories and a number of cooperative research agreements that do research to inform our policy and to hopefully give industry answers to how they can prevent these pathogens from being in foods that Rob talked about. And then finally, outbreak response. We're doing a really good job, as I'll talk more of it in a bit, at knowing what foods are contaminated and where they're contaminated. And frankly, it's outpacing our ability to understand the how and the why they got contaminated. And that's my office's job, but it's a hard one. How did these foods get contaminated and why? There's a lot of investigation work that has to go into that. And ultimately figuring out, how do we get to prevention? So today, I'd like to walk you through the new era of smarter food safety, right? So if you look at the agency, we have regulatory authorities. We're different than the CDC. CDC doesn't have regulatory authority. We do. We have been given by Congress and the Obama administration new tools, new regulatory authorities known as the Food Safety Modernization Act. Which is great, right? It helped us to do a number of things, put out a number of regulations, yet that only gets us so far. There is a recognition that the world is changing and that the marketplace is evolving, and that as an agency, we can't sit back and rely upon our suite of regulatory tools. That we have to go about our job in influencing industry and even ourselves a little bit differently. That'll be more clear in just a moment. But first, let me toss out our vision. So imagine if you're at the grocery store and you've got a bag of lettuce and you go to scan it and immediately it doesn't scan, right? We've all had that experience. Beep, beep, beep. But in this case, it was a bonk. And what that meant is that it was determined that that lettuce was unsafe and that scanner was locked down. You couldn't scan that product. It could not leave that store. Why is that so important? Well, I will sit here today, folks, and tell you that we discovered an outbreak of onions that caused nearly 1,000 cases of salmonellosis, red onions, earlier this year. And by the time all that food was recalled from the marketplace, it was 3 weeks that you, your loved ones, my mom could go to and procure foods, buy foods in which that food could be contaminated. And that's not okay. We've got to do better. What if my mom and your family got a text message to let you know that, hey, you're still in your driveway getting home from the store, but you got bad food? What if we were to have massive data systems that we're on the wall, just like my favorite movie, where we were taking all the massive data on climate, and we're taking all that and being able to make better predictions as to the product that's coming into this country and whether it was contaminated or not at imports. And what if you got an alert on your smartphone to tell you that your dinner had reached a safe temperature? Most of what I've talked about here are not things that the FDA can do. We have to find ways to incentivize, to work with industry, to advance standards to make that happen. And so this slide is about tossing out our vision for this. It's the new era of smarter food safety. We put out a blueprint. If you Google today and say FDA food safety blueprint, you'll see it. And our goal in this is to significantly reduce the incidence of foodborne illness in this country. Lots of terms thrown around here, right? It's FSMA-based Food Safety Modernization Act, but there's also a lot of emerging technologies and traceability, machine learning, sensor technology. There's a lot at play here that's beyond our regulatory tools and abilities. So the blueprint, if you had to distill it down into these 4 buckets that I'll speak to today, are tech-enabled traceability. We don't own this space. We can influence the space, but we don't own it entirely. In fact, very little of it, I should say. We have to incentivize. I'll talk more about that. Smarter tools and approaches for prevention and outbreak response. New business models and retail modernization. And then finally, food safety culture. And in the time that I have today, I'm thrilled to be able to share with you our vision behind these 4 areas. I want to make sure that we're clear. The FDA, I'm very proud of the work this agency is doing. What we're getting at here is this is a new era where we think we can all, with industry and consumers, do better. So the first bucket on tech-enabled traceability. What if we had a world where we had a harmonized system of traceability from farm to fork? Folks, today, many of the struggles that we're having are with farms. And many of the outbreaks that we're working with today are pathogens, Shigatoxin producing E. coli, and that are finding their way into produce. We are struggling in that we know that this country of ours has grown up where cattle farms, just like the musical Oklahoma, cattle farms are often next to produce farms. And we have incredible disease detection abilities that we didn't used to have before. And what we have to figure out is how do we get a lot better at tracing foods from farm to fork? Why? Because we got to get bad foods out of the marketplace. We're going to focus in a major way on finding ways to help firms get cost-effective and transparent technology-enabled tracing systems for all foods. What if consumers had greater confidence in the food supply due to the FDA's ability to quickly find and remove contaminated food from the marketplace? And frankly, as we have in this picture, that finding out the bad food didn't look like this. Today, there's reams of data that have to be processed, and frankly, it's not all digital. Too much of it's not digital. It's not in a manner, a format that can be easily searched. And it's very, very hard for us to do traceability. We know the Centers for Disease Control says we've got clusters of illness, and we think, having talked to consumers, that it's related to these foods. And then they chuck this over to the wall of the FDA, and we have to do the trace. And that what that means is we have to say, you know, based on what the FDA has told us and the foods that were purchased, we've got to try to get to the farms to find out what food was bad and get it out of the marketplace. And it's a very difficult process. So one of the first foundational elements that I'd like to share with you is on tech-enabled traceability. And there's a foundational component known as the Section 204. This was a rule that we were required to put out per the Food Safety Modernization Act that tells us that we need to identify those foods that were most problematic. Folks, the single most important thing we can do when when people get sick is to get bad food out of the marketplace. And as I mentioned before, the onions took us nearly 3 weeks for manufacturers to identify those foods and to get them out. That was the summer from July 31st through August 19th. We don't have a good traceability system to track foods from farm to fork. And this Section 204 in a draft regulation today puts out our thinking on how we can develop or pave a way for industry to adopt and leverage a more digital, tech-enabled traceability system. If you remember Thanksgiving and Christmas of 2018, 2019, I want to say it was 2018, we effectively came out and said, don't eat romaine lettuce. That destroyed the livelihood of a number of farmers, damaged that industry so much. Why did we have to say that? Because we had signals telling us people were getting sick from romaine lettuce, but because we don't have the traceability systems in that category, we had to just say, pull all romaine lettuce, don't eat it. And that was incredibly damaging. And our sweet spot would be that we had traceability and we knew what farm, and when we put out a recall alert, we could say it was this brand, this farm, this date, and get that out of the marketplace and not tell the entire industry and consumers, don't eat romaine lettuce. So 204 starts off with these baby steps, and these are the foods that, based upon their frequency of outbreaks and occurrence of illness, the severity of illnesses, the likelihood of contamination, the potential for pathogen growth, what we know about the maturity of that manufacturing sector, the amount of consumption of that food, and the cost of illness. These are the ones that we're saying, hey, new rule, you've got to be able to trace these foods and do it fast. It's got to be digital. So we're very excited about this. This is in draft. We just supported the extension for comments to come into us, and we believe this is a game changer. These are the foods that have been most problematic, and we're starting here. These foods have a history. We can also change these if a category of foods makes significant process. And frankly, we've seen good downward trends with shell eggs and Salmonella enteritidis. They may come off the list one day. We don't know. We're going to let the data tell us. So yes, we are going to encourage, incentivize industry adoption of new technologies. I made a mistake when I presented to an Apple Association of actually having that barcode on there, and I got some. Are you really going to require that? No, we're not. We're not going to require that. It's just to illustrate that we want to incorporate technology into this tech-enabled traceability, and we really want to put this in the hands of the consumer. They know I got bad food and I know I've got that in my pantry. Okay, bucket number 2 is smarter tools and approaches for prevention and outbreak response. So this is about a tool called root cause analysis. Top line is that this is a tool that's used in many other sectors. When the Challenger went down, root cause analysis is conducted. When planes crash, root cause analysis is conducted. Yet this is a tool that really is not implemented within the food industry. And our dream is that these tools were standardized and adopted. And we'll go even beyond that, the information was shared. So let me tell you a little story from my private sector days. When I learned that a competitor of the company that I worked for had a problem, they shared with us that they had a problem, and this is why it happened, and that they had a recall. And I'm able to go to my leadership and say, you've got the exact same condition within your plants, and we have an opportunity to prevent that. That raises all boats. That helped me dislodge capital from my company that I work for. And what a great way to share. What a great way for other companies to learn from mistakes or issues that other companies have. So our vision is that we prevent outbreaks by building root cause analysis reporting structure with all partners. We also have a vision that we use predictive analytics. A simple way I look at this is going to a concert in St. Louis, and you're going to go see the Rolling Stones, and Uber says, okay, Rolling Stones, I'm going to need to have a bunch of cars, a bunch of drivers out there, and then outside the auditorium. And then they realize that because of big data, there's some big rainstorms that are coming in right at the time the concert's over. And they say, all right, we need to get more cars out there. And so they increase the rates so that more drivers come and are sitting outside the stadium. That's how I look at big data and predictive analytics, that we went and scoured all the data that we know from climate conditions, from history of manufacturers. And when that big old ship comes to the dock, it's not just a blind sampling that we pick blue cartons to sample, that we have some intelligence to know that that blue carton or container is coming from an area that we have grave concerns about aflatoxin because of the climatic conditions and the drought that they've had in that country. We're doing that today. We're showing tremendous success for seafood. We want to do more. We also have a dream that we would build public and private sector data trusts, where all data is piled, and not only FDA can make predictions, but that industry could make predictions, and that the company that's procuring nuts from that part of the country simply doesn't buy them. They don't rely on us to stop the container from coming in. They don't procure that because they know that there's a risk from that area. Domestic mutual reliance. If this were done, current outbreak and prevention information was shared across all the regulatory partners. And as I said, that we build these public and private sector data trusts, and that, you know what, we built a national multi-level training university, and we raised all boats. We helped people better understand the data that's out there. We shared, and people could tap into that. These data trusts exist in other sectors where people pull information and share it for the greater good. We don't do that enough, hardly at all, frankly, in the food safety world. The next area of great focus for us is the application of technology to inspection, training, and compliance tools. You know, for those of you that have cars, I don't. I moved to DC and my wife and I sold everything, including our cars. But when I had a car, I remember cleaning it out before I sold it, and there was a map, and I hadn't looked at it, and I would guess 10 years in the glove box. And the reason why is because my confidence in Google Map and Apple Maps increased so much that I didn't use the map. I relied on the technology. I trusted it. In fact, it worked so well, it displaced the map. You know what? That can exist with our inspection tools as well. It doesn't have to be the way that we're doing it now. We may be able to, when we're exploring, if there are technologies that we can use to enhance our inspections. We're also asking, can we maximize food safety by fully leveraging sensor technology? And that thirdly, back to the root cause analysis, if these were shared, you know, we don't want to send our inspection force after companies that have a tremendous history, a strong food safety culture. We'd really like to go after the areas that are struggling, because those are the ones that are most likely to put out bad food. And so can we look at root cause analysis data and adjust where we're going to audit firms and inspect firms. And then finally, on outbreak response. I will tell you that this is a tremendous opportunity area, that if this were done, state, local level foodborne illness data was rapidly captured at the federal level. We had a well-greased pipeline where that information was coming in, and we at the federal level could act, because foods most often are going across state lines. Some states are doing this really well with us, but not all. And we also see a world where these pathogen sequences are submitted from laboratories. So what does that mean? Well, for those of you that like, you know, CSI and those types of shows, the world of microbiology is all about genetic sequencing. And just like you and I are different, so are bacteria. And we know that there are certain strains that are particularly problematic. What if we could find a way to get these sequences uploaded, not just from regulatory laboratories, but also from industry testing laboratories? Now, that is going to be a tough one, because of course these are private laboratories, but you know what? Those private laboratories test more foods than the FDA does by far every single day. And is there a way that we can, for the public health good, work together, that when bad foods are out there, there's early warning signals? I don't know. We're in an early stage of that, but we don't apologize for asking this question. Hey, a lot of our foods are global. Can we globalize an early warning system? And can we, for those of you that get the flu or think you have foodborne illness, can we tap into medication sales or dining apps or Google searches to give us regional data of where people are getting sick, and we can feed that into our surveillance to try to identify who's getting sick and from what. And then finally, we ask, are we doing as well as we can be on recalls and notifying consumers? And I would submit that we're not. Why can't we have one food supply and one regulatory recall notification? We standardize it. We think we can do better. And why can't we think of Amber Alerts in the food world. Why can't we do that kind of thing? Sure, it doesn't need to be your phone blows up when it happens, but again, our vision would be that if you purchase that food, that there was a notification directly to you that that food was bad. Folks, I can tell you that the business models are changing, and we don't understand them nearly to the degree that we need to. This slide we actually put together before COVID. Living in the city, I can tell you that so much of e-commerce is going on for foods. The grocery store is going, people are buying online. The apartment complex I live in, they put new racks in because people aren't going to the grocery store. We had some Whole Foods that shut down people going in so that just firms that were contracted to deliver food could go in the midst of the pandemic and pick up the food and deliver it because they didn't want to have consumers in those stores, and it was more efficient. My point is that the business models are changing, and we can't sit here today and say that we understand them all. Nor do we feel that we've got the right regulatory framework in place to regulate them. And so if this work were done in new business models and retail modernization, we would have a framework for regulatory oversight and seamless operation of food produced and delivered through the U.S. through e-commerce and these new business models. And not only did we have a framework, but we understood roles and responsibilities, right? Who owns that food that is delivered hot and sits all day on the shelf because it was supposed to be delivered at 6 p.m., but they delivered it at 6 a.m. and now that food is bad. I just use that as an example. I'm not an attorney, but these are questions that have to be resolved. And so we're looking at, in these new business models and retail modernization to modernize traditional retail food safety approaches. And in this, our vision is that we create tools and deliver training that embeds retail food safety management systems. A lot of illness is occurring at retail, at these commissaries, at restaurants. And we have more that we know needs to be done to address these risk factors that we're seeing, or quite simply, non-adherence to good manufacturing practices or good hygienic practices in these retail environments. And that furthermore, we have the data to support that we're reducing the risk of foodborne illness risk factors. Okay, I'm going to finish up with this on food safety culture. And you might say, what exactly does that have to do with food safety? The fact is that leadership sets the culture of an organization, and leadership sets the strategy of an organization. Leadership sets the culture, and we believe that the culture of food safety needs to be examined at a lot of levels. If you look at food safety culture throughout the food system, there's elements of health psychology, public health, cognitive science, health communication, social psychology. Quite simply, behavioral science is at play. What do people believe about food safety, and how do organizations react? What do organizations believe are their priorities? And very importantly, how does leadership go about setting a culture of food safety? Let me tell you a quick story. The last company I worked for, there were some manufacturing challenges, and we wanted to bring focus on this. And so we had audit groups that went in from our corporate offices to go and do third shift sanitation audits. And at plants, third shift sanitation, that means, the midnight crew, they're cleaning up the plants, and typically a quality manager at the plant would be there to work with the crew that came in from corporate to audit the facility. Well, in this instance, what we elected to do was to ask our CEO to go along with them, unannounced, to that plant. And not only did the corporate sanitation audit team come in, but the CEO was with them. And after we taught the CEO how to use the flashlight, no, it's a joke, that's not really true. They went and did the sanitation audit, and the CEO's with the flashlight, inspecting equipment. This company is a multinational, and I will tell you, by 7 a.m. the next morning, as leadership came into office, every plant globally knew the CEO cared about food safety and stepped away from talking to investors and went to the plants and inspected equipment. That set the tone. that sets a culture. We're thinking a lot about this and how we can help companies in leadership of companies set a healthy food safety culture. What are the steps that they can take to set that culture? We're not only talking about our industry culture, we're also talking about the agency's culture and how we can promote food safety throughout the agency. We're also talking about it at the consumer level. And how do we develop and promote a smarter food safety consumer education campaign? So folks, I'm gonna wrap up on this. We have a management team. We've identified deliverables short term. We have a very collaborative approach that we're taking because, as I said, the food regulators, us, can't do this all. We need collaboration. We're being very transparent and letting industry know what we're thinking and how they can engage. And I'm actually spending a lot of my time out there talking with industry, asking them to work with us. If you're at all interested in this topic, you want more information, you want updates as to what we're doing, here's the contact information, the server where you can contact to get more. And I'll leave you with this, there's a lot to be done. I'm very proud of the work that the agency is doing, but I hope I've left you with there's more that can be done, and it requires a different way of thinking. We're early in the ideation phase, and we need partners to advance these shared goals, which is why I'm very thrilled to talk with this group today. We're hungry for ideas. The question that we're asking is, where do people want to engage? Where do they have areas of particular interest? And have them come to the table to work with us. And what I'm asking everyone, including this group, is to consider these opportunities and advise where we can work together. I will leave you with one thought, and then I'll go back to Rob. There's a lot of creative thinking that has to be done in this space. I want to give a shout out to the retailers. And you might think, why is the guy that's running the Office of Food Safety giving retailers like Walmart and Wegmans and many others credit? Well, they are playing, many of these companies are playing a leadership role in requiring things that the agency can't because of our regulatory authority. Walmart, Wegmans, other firms like that have the power of the purse, and they don't want to sell their customers contaminated food. I would argue that's a pretty bad business model. What they're doing is they're upping the game, and they're sending letters to produce growers and saying, if you're going to do this, we want you to do this. If we're going to buy from you, we need you to have this much separation from adjacent cattle activities. They're requiring things that we don't have the regulatory authority to do. And so I leave you with that thought to know that this is bigger than just the FDA, but involves many, many different stakeholders to really take us to this new era of smarter food safety. So with that, Rob, I'll go back to you and see if there's any questions.
All right. I'll tell you what, I'm impressed. And you think of the FDA as just 3 letters, and you have no picture of what it's about. But I think you gave us a very clear view, and also maybe a comforting view, because it feels like you have a lot of great ideas and work in the right direction, and it makes me feel a little bit better. So let's get to some questions here. One of them that came up was about GMOs, how they impact food safety. And I'm going to add a little bit to it, is because GMOs has an international part, because we have countries that we sell products to that are anti-GMO. And so there's the challenge there of that. So you have a 2-point question there to talk about GMOs. First, the safety and for us, and also how we get along with our other neighbors that we trade with.
Yeah, what a really interesting question. I'm gonna give you a bit of Mark's personal opinion, not the FDA position. So don't use this on me, okay? Please. Having come from the private sector, I think industry would tell you that they've learned that consumers procure foods, buy foods based on beliefs. When I first started off in my career, I thought it was about taste and value. And increasingly, the marketplace has changed, and people don't buy foods simply based upon value. They have beliefs. They want to know that this food was produced under conditions that aren't advancing global warming or using child labor. There's a whole bunch of beliefs, and hats off to them. Consumers get to make those demands, and what I will tell you is the marketplace will respond, and they have, and that's led to an explosion of foods, including organic, that reflects beliefs that people have. And so, the agency is frankly a bit agnostic in that place. That's not ours to weigh in on. What we do is worry about the safety of these foods. And I'll just tell you that I shudder every day when I receive the outbreak reports that we are detecting of kids that have come down with hemolytic uremic syndrome from eating contaminated products, that their livers or their kidneys are being shut down, that, elderly people have died because of listeriosis, that mothers have lost children because of listeria infections, Campylobacter. I shudder every day when I read these reports because we're getting so good at detecting disease outbreaks. I worry about that every single day, and that consumers, when they go to the store, are playing a little bit of Russian roulette, and that's not okay. That bad food is out there, and people could go home to their kitchens and eat bad foods. I don't every day think about the safety of GMOs. In fact, we've had probably the biggest experiment going on the safety of GMOs that's ever been done in human feeding studies for the past 20 some years. And I don't know that anybody can point to an individual becoming sick, a single individual becoming sick because of GMOs. Yet that's an area of intense consumer focus. Again, not all based on food safety, and I have to acknowledge that. So I tell you that as a food safety professional, I know what I need to spend my time on and what my office is spending time on, and it's trying to prevent these kids and adults from getting sick and dying. I don't spend my time worrying about GMOs. Having said that, we have teams that are very closely watching these new GMO technologies, the genetic engineering tools that are coming out, CRISPR technologies that are being applied. And we have to be on the wall. We have to be humble and recognize that we need to make sure these foods are safe. We have that job to do, and we do it, I believe, very well.
So let me ask you, we talk about the food coming from other countries is a big issue, and you have all these safeguards. We have treaties, I assume, that talk about this when we do trade deals. And do the other countries follow through with what they say? And, in the same way that, back to the GMO thing, we've been told that they don't want to buy things or send things that are GMO. So I think it's a back and forth that happens there. So how does that work?
Yeah. So our office actually partners with our international group, and we work on just that. These agreements with the food safety arms of these other agencies in India, where, for example, much of our shrimp, for example, is coming from farm-raised fish. We spend a lot of our time evaluating the food safety systems, and when we get to a point where we feel that they have equivalence, we can then sign these agreements that permits that trade. We just recently did that for shellfish with the EU. Think of scallops and things like that. Once we have confidence that their systems are equivalent to ours, then we can proceed and that trade can continue. That's good for our farmers and for theirs. So yeah, we do that. The trade should follow when we have that confidence that their systems are strong.
So are there certain countries that are you more comfortable with? Like one of the questions was asked about Chile, for example. We buy a lot of produce, and then we get a lot of things from Mexico, China. China had the problem with selling sheetrock that was bad, you know. So are there countries that are on the kind of alert list that you have to pay better attention to what's coming in, or is it all covered?
Yeah, you know, that's the beauty of the. Well, the short answer is yes. I can't tell you, and I won't tell you who those countries are, mostly because you can Google it. We have import alerts that we put out that when we have, for example, we have had a string of papaya outbreaks that have occurred in this country with products that have been imported from another, and we have import alerts. And you can't bring them in until either A, they're tested, or B, we can just ban you completely and not bring them in. And we do that to get the attention of those countries. We're trying, as I mentioned before, with the picture of the container ship of really digitizing that. There's a lot of data that's out there and feeding that in so we can make better decisions, not just based on outbreaks, but, you know, kind of weaving back to what I was talking before, Rob, about all other data, weather systems that might be influencing that food to make it bad. So, yeah, I'm not giving you specific countries. You can pull up our import alerts and see who's on the wall of shame.
Along the line, and we seem to have a lot of questions about different food issues that are local, but I wanted to ask, you know, fish farms, you know, and other farms like that where, you know, reportedly the fish swim in their own crap, but versus wild fish. Is that real? Is that an issue? Does that ever come up to your thing? I know there's two levels. There's food safety, and then there's whether something's better for you. And I don't know if you can answer on that level, but.
Yeah, you know, unfortunately, because of the pandemic, my seafood team is not here. They could answer that question. What I can tell you is that we've got teams that are looking at that very, very closely. There is an increasing market for that type of farm-raised fish. It's an area that we're watching very closely from a feed, you know, that's being provided to these fish. Any accumulation of waste products. So no, I can't comment on the safety of that, other than it's an area that is one that we're watching closely.
All right. So let me a question, and I'm not sure. It's from Kyle. Joe Kyle says, "How does the slow food and local food movements have an impact on food safety at all?" I mean, certainly, I know I try to buy local eggs. I go to the local farms and get produce and quite often. So it would be a good question. I think a lot of people would be interested because it's our real lives. So what do you say about that one?
Yeah. So, you know, you have to remember you invited a food safety guy to this meeting. And so my comments are going to be rooted solely in the food safety, recognizing that there's a lot of other benefits from buying local. I get that. I really do. And I want to acknowledge that. Where I have to, though, push is on a couple levels. And that is that people don't automatically assume because it's local, it's safer. There is when we hear about outbreaks, it's often because there's been a critical mass of them, and it's risen up to the CDC level, and they do cluster analysis and identify what foods are a problem. But when you have a local manufacturer, it may fly under the radar screen. And so I just put out there to state that I don't want people to have the impression that simply because it's local, it is safer. And so I would be irresponsible if I didn't point that out. I would also tell you that we have limited regulatory authority when it comes to local. Congress gave us certain sales volumes that firms have to meet in order for us to be able to inspect them. And so we don't get to many of the small farms and growers. That is not to say that they're making unsafe food. Please don't misunderstand me. But, you know, as a scientist, I have to point out that good food is made through good hygienic practices, and that requires an investment of training. And sometimes big firms don't invest enough in training, and sometimes small ones don't invest enough in training. And so I'm just going to leave you with that, choosing my words carefully, not to slam local, because I don't want to send that message. But yeah, I'll just leave it.
Well, I would think that the one thing about local that is a positive is that those people are usually eating their own food. So they are their own test market in a sense. So I would think that.
Well, this is true. This is true.
Yeah. So when you talk about food, we're talking about produce, or does that include processed foods? Do you guys look at that?
Yeah, Rob, we got the whole grocery store. You know, the USDA covers the meat and poultry, you know, got that section of the grocery store, but we got everything else. And it's a bit difficult in that we cover 80% of the food supply, yet the USDA gets the vast majority of funding that goes into food safety, into the regulatory agencies. So it feels a little bit out of whack. There's reasons that go way back that you know, before my time, but yeah, we USDA covers the meats and poultry. We got everything else.
Okay, well, funny. Back to farm-raised fish. A little deeper into it, we have a question about how do you, at the FDA, assure the public about the safety of them? How do you actually, when they come in, what are the testing that you do for farm-raised fish?
Man, I wish I could answer that question. Sorry, Rob, I'm drawing a blank on that one.
All right, no problem. I'm just trying to figure the questions out that we have. You know, because we have some interesting, but farm-raised came back up. Here's a good question. Is there any concern about food being weaponized? That's an interesting one from Karen.
Yeah, so food's being weaponized, i.e. food's being intentionally contaminated. I think that's what they're getting at.
Mm-hmm. Yeah. So
yeah. Well, yeah, indeed, that has been an area that the agency has spent a lot of time on, and it really comes from FSMA, Food Safety Modernization Act, and it really stems back to 9/11, where there was a lot of concern about many things being weaponized, including the food supply. And so companies are required to have a food defense plan. You know, if I had to give explain this to my aunt, it would be that companies need to know who's in their plants. They need to know who's got access to their plants. They need to look at key process points and make sure that they have control of that. You know, picture a great big vat, and if anybody could walk in from outside and put some adulterant into food, then companies really need to, or something dangerous into the foods, some companies need to have either a lockdown system or some cameras or some ability to track what's occurring at that process point. So food defense plans are required in industry, and companies have to follow that.
Oh, that's interesting. Because that's definitely a concern I could see. And how do you follow up on that? Now we have a question that I would ask about, because we have a new administration coming in, and it gives you thought. How does different administrations affect you? Is there an issue that from one to the next, do lobbyists, industry lobbyists have more power at different times to say, well, these standards need to be lowered or raised and all that, and how does that affect what you do?
Yeah, I really appreciate that question. One of the things that I'll offer a couple things along that line. One that you didn't get at directly, but one that I think I like to tell people. There's this thing that government workers have to abide by. It's called the Hatch Act, H-A-T-C-H, Orrin Hatch put it in place. And in the workplace, we are not allowed to discuss politics. If I have a picture of president from one party in my desk, I got to have another picture of an equivalent competing party on my desk. And it's intended to rightfully pull politics out of the regulatory space from these agencies. And so we really do not discuss anything on the political front. Certainly there's people that are years ahead of me that are political appointees that have to play in that space. But I set that up to state that, and something I think people should be proud of, is that people like me that are in the trenches leading teams, we're not really affected by that. We have our agendas. We have our funding that comes from prior congressional funding, and I'm right now putting together funding requests for 2 years out. I'm working off a continuing resolution. And so the truth is these regulatory folks like me are a bit insulated from that. We have our job to do, and we're going to do it November 10th, and we're going to be doing it in July. Not much changes. Now, the prior administration came in and said, hey, we want you to pull back, I think it was 2 regulations for every one that you put forward. And so, yes, we did go through that effort. I actually think that's a fairly healthy thing for companies to do, to make sure that, or for agencies to do, personal opinion is to make sure that we are looking at our suite of regulatory requirements and making sure that they're right sized, that they're achieving public health goals. And I think that was actually a pretty healthy thing. But long answer to your question, Rob, pretty much not impacted by it.
That's good to know. It's funny because I asked that question and then someone else came up with basically the same question, because it does concern us. I know there's one, and this one might be hard to answer, but I'll give it to you.
Is it going to be easier than that fish one, Rob? Because I didn't fish one.
Well, are there certain food stores that do better than others in making sure their suppliers are providing safe products? So that's a question that might not be able to answer because of it's kind of. But you could do a yes or no, I guess.
Well, I love the question. I can answer it in the affirmative. Yes, there are companies that I know have very positive food safety cultures and are adamant that they are going to do their part with the power of the purse. Again, I pivot back to the major retailers that are demanding things that I can't, as a lady of the Office of Food Safety. I don't have the regulatory tools to require, in this case, farmers to do, and the retailers are, and I give them a lot of credit for stepping up. They're not legally obligated to do it. They're doing it because it's the right thing to do. Conversely, yes, I know that there are other companies that just don't have a presence in that space.
Well, I think we're coming close to the end. I wanted to give you just a minute to add anything you felt like we hadn't covered, in terms of your chance to, focus on something, if anything has come up.
I'm looking at my notes, and I think I've covered all of it. I want to leave you with this. I don't want to have anyone fear their food supply. I do believe that our food supply is safer than what it was. You hear more and more about outbreaks, but it's because the tools in the toolbox, the technology, the public health infrastructure, the internet allows sharing of genetic sequences. Our ability to detect pathogens is skyrocketing. And so you hear a lot more about it. But you know, if you go back, 30, 40 years ago, you would hear, oh, Aunt B died? Why? Well, I don't know. We don't know. She just died. And it may have been that there were a bunch of Aunt B's that passed, and we just didn't know that they all ate the same bad food. And so just because we know doesn't mean our food supply is less safe. I am confident in our food supply, but yet I know we can do better, and we're discovering those problem areas. And our new era of smarter food safety is all about taking the game in partnership with firms to get it even safer, to move, or as we talk about here, bending the curve of foodborne illness, and making sure that just consumers don't have to take a risk when they get to the marketplace. So I would leave you with that, Rob.
That is great. Great. I want to thank you. The World Affairs Council of State wants to thank you, because I think that we all enjoyed hearing what you said, and I think it really does give us a sense of what's going on this major issue. So I thank you again, Mark, for coming and sharing with that. And I want to also thank our sponsor of this event, retired Colonel David Davenport, for helping make today's event possible. I'm glad you could all join us, and hope that you register for the next event in our America and the World Conversation Series on November 19th, which is a Thursday. And this one is going to be also very interesting and very different. We're having an eyewitness account of the explosion in Beirut and its aftermath. And so for more information, please visit our website, upstateinternational.org. And thank you again for coming, and hope to see you on the 19th. That's it. Mark, thank you again.
Thank you very much.
Appreciate that.